Welcome to the Health Fix podcast, where Dr. Janine Krause, that's me, gives you, a health junkie, a weekly dose of tools to help you increase your energy and resilience to life's stressors. The Health Fix podcast is sponsored by Blue Blocks. That's BLUBLOX. Those guys are blue light blocking glasses. And let me tell you, I have been using their computer glasses for over a month now, and I have not had any headaches. I'm not feeling fatigued at the end of the day, and I am feeling great. That strain from me being on the computer and having these awful fluorescent lights above my head has gone away. So I challenge you to check out Blue Blocks, BLUBLOX today, and see what they can do for you. Hello there, health junkies. Welcome to another episode of The Health Fix. I'm your host, Dr. Janine Krause. And on today's episode of The Health Fix, we are talking all about amino acids. So this is another podcast dedicated to a listener who asked me about amino acids and what amino acids are good for what. So I decided to break down kind of my favorite ones and talk about the ones that we get the most bang for our buck, and I put them into some categories. So we're going to be talking about amino acids for weight loss. We're going to talk about amino acids for the digestive system. We are going to be talking about amino acids for the skin, athletic recovery, all kinds of stuff. So buckle up your seats. This is going to be a fun one. I'm going to geek out. So grab some significant amounts of some tea so you can have your brain firing on all cylinders. All right, let's get started. So the amino acid industry itself is like $1 billion industry. It's a big deal. And you've probably seen supplements all over the place touting this benefit, that benefit, blah, 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 of amino acids. And one of the most popular amino acids right now is N-Acetyl Cysteine, which is an amino acid that helps with boosting immunity, but also works on cough and excess mucus production and things of that nature. So that one's been all about, all over the place for what's going on with the pandemic. Now, another really popular amino acid is taurine. It is one of the active ingredients in most energy drinks and some of the most popular companies you've seen out there. What does taurine do? It boosts energy, but it has a lot of other benefits. And I'm going to be talking about what you typically see out there in terms of promotions to you about amino acids. So stay tuned for that. But before we jump into some of the really big issues with amino acids, let's start talking about what the heck they are and what we're looking at in terms of essential versus non-essential. So we're going to give you a little bit of a biology lesson, if you will. So what are amino acids? They are breakdown products of proteins. We can make some ourselves. We cannot make others. So we have essential ones, which we can't make ourselves. And there's this huge debate as to whether there's 8 or 9 of them. As far as I can tell, and from all of my education, 9 is the standard number. Now, non-essential aminos, there's also debate. Is there 11 or 12 of them? From all my research and from my education, I'm going with 11. But hey, I'm open to discussion and arguments if you have some statements you want to put out there. So comment. Let's look it over and see if we can help figure out and settle the score. So essential means the ones that we can't make on our own. So we can't get it from our diet. We almost have to, we can get it from our diet. We cannot make it internally on our own. The non-essential aminos are ones that we can actually synthesize within our body on our own. So we don't really have to supplement them. However, when you're thinking about amino acids, you have to think about, okay, first and foremost, how much protein do you get in a day? The average person is usually 50% lower than what they should be eating in terms of protein. And those who are vegan and vegetarians, it can be done. You just have to really be diligent about looking at your balances. And my vegan and vegetarian people are who I worry about the most in terms of proteins. Now, when you look at the overall scheme of things, if you take your body weight and you can calculate how much protein you need a day at 0.8 grams per kilogram. So you have to figure out what your body weight is in kilograms, and then 0.8 grams per kilogram is the standard amount. If you are physically active with your work or you're lifting weights, you might want to consider 1.0 gram per kilogram for protein intake. And if you're even more active, like 3-4 hours a day training for something, you might be needing to go up to 1.2 to 1.5 grams per kilogram of protein. Now, this podcast is not about protein intake. It's just that you need protein to make amino acids, and in particular, your non-essential aminos. You need some foundations there, and your essentials, because you can't make your essential amino acids. You need it from an outside food source. And there are carbohydrates that lend to making these as well. So it's not all protein, but it is part of protein. And so that's why I do talk about needing to be really diligent on making sure you are getting sufficient amounts of protein. Now, how can you do that without brain damage? Eating closest to nature. Foods that are coming in their natural form. Processed foods are going to be lower in protein. Granted, you could argue that in terms of sausages and processed meats, but I'm talking about white flour processed stuff. Okay, enough with the public service announcement. Let's get into talking about amino acids. So in particular, these essential ones, the ones that we cannot make, I do recommend supplementing with an amino acid powder if you are extremely active, if you are an athlete, if you have a job where you're walking all day long, moving around. It's something to think about. And Ben Greenfield has a great one. He's got a great product. So does Thorne. Thorne Supplement Company has a great powdered aminos. They have one in like a lemon flavor and a berry flavor. The lemon one tastes like lemonade. It's kind of good. So anyway, let's talk about these essentials. So tryptophan is one of them. A lot of people know tryptophan for how we get the sleep coma after Thanksgiving turkey. And we're just like, wanting to crash out and get super sleepy. Tryptophan definitely helps with sleep, but it also helps in the promotion of making something called serotonin. So it is a mood booster and can be extremely helpful if you're suffering with depression, struggling with your mood, just feeling low in energy. And while it sounds weird because tryptophan makes you sleepy, the end result is that it actually helps with production of serotonin. So, hey, think about it in that case. And I think for a lot of people living a stressed life, we tend not to make enough of serotonin, and then subsequently serotonin converts to melatonin, which helps us to sleep. So if you're struggling with insomnia, you might want to consider some tryptophan to help you out. Now, there are great food sources of tryptophan. I had mentioned turkey as being one of them. Dairy is also another one, and you can also get tryptophan from some of the whole grains out there. So these are things that if you are vegan or vegetarian, you do not have to be relying on turkey for your source of tryptophan. Now, lysine is another one of these essential amino acids. Lysine is very popular for helping with an antiviral effect. So great in cold and flu seasons when you might need a little boost. Also amazing as an alternative for a treatment for herpes. Or if you get cold sores, in particular, herpes 1 there, that you can take up to 3 grams of lysine and knock them out if you feel one starting to come on. So something to think about there as an alternative to Valtrex and the other medications that are on the market there for herpes infections. Lysine is amazing for the skin in and of itself, and I'm going to talk about lysine more when I go into the skin enhancing benefits. So something to think about if you're working on anti-aging, trying to get your skin looking younger and you looking younger as a whole. Now, methionine is another great essential amino acid. It's one that helps us to detox, but it's also one that's kind of like a helper. And it's great for weight loss as well because it is helping our body to detox. It gives each and every chemical reaction that it comes into play with a methyl group, which is CH3. And what the heck does that mean? Carbon with 3 hydrogens. And so it donates that little group of the methyl group, and it kind of binds things and helps to move things along the line. It's a helper. And so methionine is always one you want, especially keeping your weight in check, metabolism, liver, heart, pretty much any organ in the body. So that's a great one to be thinking about in terms of metabolism. Threonine is another amino acid that is essential, and this guy is immune and connective tissue. So this is once again skin, things of that nature. I don't usually individually supplement threonine like I would individually supplement lysine in the case of a cold or a virus coming on or a cold sore. So threonine is usually going to be in a combo formula. Now, isoleucine and leucine. These guys are your amino acids, your branch chain amino acids in particular. So isoleucine, leucine, and valine, those three guys all pair up to create branch chain amino acids. And perhaps if you are someone who is athletically inclined, or maybe even back in the day you were trying to prevent post-workout pain in your muscles, something known as DOMS, this is where your branch chain amino acids are extremely useful and can be a game changer, especially if you're struggling with post-workout pain. So those branch chain aminos are essentials. We do not make them ourselves. We have to get them from our diet or supplement them. And in the case of those of you who are starting a new workout program, or maybe you're training for something, even like a marathon or something of that nature, or an Ironman or half Ironman, these branch chain amino acids can be really, really useful for you, especially if you're vegan or vegetarian and not getting in all of the animal sources of proteins that you should, and struggling with balancing the plant-based things. Because I've been down the vegan and vegetarian route. I was vegetarian from age of 7 to 24. And if you've listened to any of my other podcasts, it's because I didn't know what meat tasted like, because my mom made meat in the microwave, marinated in Italian dressing. So I just thought meat was gross. But then my eyes were opened up as I got older. But I was like the worst vegetarian ever. I was a cheese and breaditarian. So I'm just calling folks out. Like, if you don't have your nutrition dialed in as a vegetarian and you end up grabbing convenient stuff, it's probably likely that if you are also athletic, like I've been most of my life, you need the branch chain amino acids to keep your muscles healthy and recovering well. Because one of the most underlooked things in fitness is recovery. And branch chain amino acids are useful in that case. So those guys are essential amino acids. Then the last but not least of our list here, I actually have two. Our second to last one, phenylanine. This guy helps with hormone production and really, really useful with nerve conduction. So helping with your nerves. It's not something that I would supplement on its own. I would use it as a combination in an essential amino powder, because the essential aminos do have a synergistic effect. But this could be really nice for helping folks with hormone balancing as well. So something to think about when you're thinking about choosing, do I need an essential amino powder? Do I not? It's also used a lot in pre-workouts. So if someone wanted to work on their pre-workout fat burn and get the fat burn enhanced during a workout, phenylanine has shown to be helpful in this case. So something to think about in this case. So there's that. Now, the last one's histidine. Histidine is an interesting essential amino in that it's kind of good for building blocks. It just kind of pairs up with other things well. And so I would consider it in that case as a synergistic effect in the essential amino powders. So there you have the essential aminos. Now, let's talk a little non-essentials. And I'm not going to go through every single one of the non-essentials because there's 11 or 12 of them depending on which department you are in. But let's list them out. Alanine, arginine, asparagine, aspartic acid, cysteine, glutamic acid, glutamine, glycine, proline, serine, and tyrosine. So those guys are your non-essentials, which your body can make on its own. So that's a lot of them as well. So that's kind of cool that our body can make our own building blocks to help us to carry out certain activities. We have amazing bodies. So let's talk about this brain and nervous system component with aminos. I think this is one of the very lucrative areas in the supplement industry, but needs to be paid attention to in terms of ingredients and what you're buying when you get a supplement. So for the brain, one of the most popular nootropics or brain-stimulating amino acids is phosphatidylserine. Phosphatidylserine is a fatty lipid-like, so fatty phospholipid, that it really works on coating your nervous system. So coats your brain, coats your nerve cells, your little neurons is what they're called, and it helps with carrying of messages. So I like to use phosphatidylserine when someone is just starting to have a little bit of cognitive decline with age, but also when someone's super stressed out and can't seem to get their brain firing right. They're like, Doc, I can't remember anything. I don't know, what's happening in my mind, but I can't process a thought. My mind's all over the place. I need some focus.
I will use phosphatidylserine for this particular case. And one of the things that you need to be really careful with phosphatidylserine is the sourcing of it. You want a company that is going to be using a sunflower-based one because it's an oily substance. A lot of companies use soy, but soy is genetically modified. There's problems with soy in general in terms of what it does to your body. So you might be giving yourself a beneficial amino acid, but negating its effects because of the sourcing and the base that it's in. So I do not recommend soybean in terms of a base for your phosphatidylserine. It's not beneficial. I do believe that the sunflower does better. Phosphatidylserine come in organ meats if you can find a clean source for those. Also muscle meats, eggs, white beans, and yes, soybeans. But I would recommend for the soybeans making sure that you're getting a organic, non-GMO based soybean if you're going to try to get a little phosphatidylserine into your diet that way. Now, one thing to note, if you're on any blood thinners for your health, you do not want to take phosphatidylserine because it does have a blood coagulation benefit, which can be good in some cases, but if you're trying to keep your blood thinned out, you do not want to have phosphatidylserine involved. Now, with phosphatidylserine, how do you dose it? What supplements are good? I really like Designs for Health. They're one called PS150. It's a great one. I've seen great results with it, with patients, with myself, and I think this is where I would go in that department. But phosphatidylserine, like I mentioned before, you don't have to be in like the beginning stages of Alzheimer's or things of that nature. It really can be when you're stressed out and can't think straight and you need some focus. Phosphatidylserine can really be helpful in that case. All right, so now the other phosphatidyl amino acid is phosphatidylcholine. So a lot of people will get confused between the benefits of phosphatidylserine and phosphatidylcholine. And so phosphatidylcholine is really good for the liver. It's kind of like a reservoir so that the body can keep choline in the liver, which choline is the true amino acid when we're talking about in the broken down form. Choline is great for nerve function, but it's also really great for signaling because it's the base for acetylcholine. Acetylcholine is a neurochemical that helps us to fire our nerves. So we need that so that we get proper nerve signaling, but also for muscles, also for your gut, for any signaling within the body. Acetylcholine is kind of like your master neurotransmitter there. So phosphatidylcholine is a great one in this case, and there are great formulas out there as well for phosphatidylcholine. I'm not as particular in that, other than make sure that your source is not coming from a soy-based source. So read your labels and see what you've got out there. But phosphatidylcholine is really great in the case of helping with neurological function. So if you've got someone with the bogged down liver that's struggling with some neurological function, this is what you want to go after in terms of a amino acid. Now, keep in mind, phospha is the fatty bound to it, a fatty molecule bound to the amino acid choline. And serine, the one I mentioned before, is the amino acid. Phosphatidyl is the fatty component connected to the amino acid serine. So, next, in terms of my favorite in the whole world nerve function amino acid, L-Theanine. L-Theanine comes from green tea or black tea, and it is incredible for helping us to just chill out. You can take 200 milligrams every 3 to 4 hours, up to 1,600 a day, and just keep that chill going. So if you've got, anxiety about the situation or something's happening in life that's got you a little stressed out, L-Theanine can be your go-to source. So L-Theanine being my most favorite amino acid, this is the one that I will pair with herbs to help folks go to sleep, like with holy basil, but I'll also pair it with ashwagandha. It kind of depends. I like it on its own, but I also like it as a combo formula. And sometimes if I need like super quick calming effect, I will take the powder of L-Theanine. So instead of it being in a capsule, I will have it in a powdered form and put it under the tongue to calm the nervous system down quickly. There's a company out there called Bulk Supplements that has the powdered aminos in a bagged form, and so it's kind of nice to do it that way if you're not so into the capsules or if you want to get a quicker effect. So something to think about there, because under your tongue you have 2 blood vessels that allow for quick delivery of supplements, aminos, whatever it may be, to the system. So something to think about in that case. Now, along with the brain and nervous system, tryptophan is in this category. I mentioned it before, but tryptophan's great for allowing the body to create molecules that make serotonin. So helping with sleep and helping with relaxation and mood as well. And then subsequently that gets converted to melatonin. So that's also going to help further down the line for the sleep. Tyrosine is another amino acid that is a precursor for dopamine. So tyrosine can be an incredible source here to help you to feel just more satiated, more calm in life, and not tend towards some, let's say, addictive personality types of behaviors as well. And it helps with general neurological function as a whole. Now, in terms of tyrosine and tryptophan, you can get both of these from poultry. You can get them from sesame seeds. Like tyrosine in particular is really rich in sesame seeds. So you do not have to be looking for always the meat source to get these. Tryptophan is also high in nuts and seeds. So these are things that you can be thinking about along the way when you're planning your meals out. Now, another really lovely nervous system amino acid is glycine. I use glycine particular for post-workout recovery and for sleep. And if you have trouble sleeping after intense workouts or have trouble sleeping after a day of hiking or something that's strenuous, you might want to consider 4 grams of glycine in a powdered form in water, kind of like your nightcap there. It's just lovely for helping with sleep. Now, it also can help prevent gut cell injury too. So when someone's participating in a vigorous activity athletically, the chances of gut injury are higher. Maybe you've seen marathoners have some gut issues while running a marathon. That kind of thing is what glycine and glutamine, the amino acid, can be extremely helpful to protect for. So it has a 2-for-1 there, but I really like glycine for helping with post-workout sleep and recovery. So if you're struggling with insomnia and you're an athlete, or you just have a physical job, or you're super into gardening and you spend hours doing some heavy lifting and things of that nature, you might want to consider glycine to help you with that recovery and sleep. Now, earlier I had mentioned taurine as being one of the most marketed amino acids thanks to energy drinks, but taurine really is great for heart health. It also helps to improve insulin sensitivity, so anyone who's insulin resistant can benefit from taurine. It can help with electrolyte balance, it can help with hearing function, immune modulation. It's kind of cool. Now, taurine really ended up getting into a lot of the energy drinks because of an Okinawan study that showed that taurine helped with longevity. And so once we saw that, then it was like, oh my gosh, let's put this in everything we possibly can. And in fact, there was a study about heart failure and taurine, and it reduced mortality by 80%, which is kind of crazy. So taurine has the ability to prevent obesity because it helps with preventing insulin resistance. It also has an effect on inhibiting arterial thickening so that we can prevent those walls of your arteries from getting too thick, because if those guys get thick, we have trouble regulating blood pressure. There's lots of benefits to taurine, and you don't have to drink the energy drinks to get them. Most studies are going to be recommending around 1.5 grams a day of taurine, and that's up to you as to where you want to go with that. My dogs are making all kinds of noise today with the podcast. I just got a scratching, and then earlier, if you heard noise in the background, that was chewing of a bone. So I apologize for them making their little appearances today during the podcast. All right, let's move on to athletic recovery amino acids and ones that help you to produce a little bit of human growth hormone. Now, a lot of people ask me, can I take a supplement for human growth hormone? Can I inject human growth hormone? At this time, it's not advised. So what do we have to do is work on different amino acids that can help our body to stimulate the production of human growth hormone to keep us lean and kind of keep us stronger for life. Also, peptides have an incredible way to help us out in that department as well. Now, amino acids being protein fragments and the byproduct of protein breakdown, peptides are also amino-based fragments in terms of protein building blocks. So they work hand in hand in the body for signaling. So it's kind of cool. Now, Let's talk about these amino acids that you might find for athletic recovery. In particular, there's injection forms that are called triamino. So ornithine, arginine, lysine may be found together. Sometimes they're found with the amino acid carnitine. And what this is doing is helping your body to excrete some of the byproducts of exercise. Ornithine in particular is great for really metabolizing and excreting ammonia because it converts it to urea in the liver and helps the body to flush it out. And by doing that, ornithine can help with increasing energy and relieving stress and fatigue from workouts, but also from the day, because I think a lot of us don't realize how the stress from our days and how we've set up our days to be quite stressful end up being like we're running a marathon. So I do tend to sometimes look at athletic recovery injections and treatments for folks who just are super stressed out, regardless of whether they're a athlete or not. So that's why I like to mention this here. Ornithine also has an effect on the GABA pathways. So GABA is a calming pathway in the nervous system to help us just relax, but it also helps us to regulate stress. And in particular, the hypothalamic pituitary axis, so this is from the brain to the little pituitary gland that's like behind your area between your eyes, that guy has a lot to do with how we fare when we're stressed out or not. And so ornithine has an effect on attenuating stress in that department. So it kind of determines how much we can handle. So something to think about in that guy, and it can be used anywhere from 500 milligrams to 3 grams a day, depending on where someone's at. Now, you might be thinking to yourself, well, how do I know how much I need? Well, there are tests that can tell you the amount of amino acids you have currently and that you're metabolizing currently in your body. There's something called the NutraEval by Genova, but there's also the company Great Plains Labs that does amino acid testing. So if you're curious, like, where are my aminos at, testing is always an option to figure out which direction to go. Now, with athletic recovery, L-Arginine is a very big amino acid in this department because it's the precursor to making nitric oxide. If you are prone to really severe herpes outbreaks, you do not want to use this amino acid because it can flare things on you. Now, in terms of arginine, it's great for heart health as well, because it relaxes blood vessels and increases circulation. Anyone who has pain, I love to give L-Arginine out because it's a circulation enhancer and it's something that goes really well with acupuncture that I do in my office. Now, another thing with athletic recovery is L-Lysine. It's, of course, an antiviral, as I mentioned before, in prevention of herpes breakouts, but it also can reduce inflammation responses and cytokine responses. Now, what does this mean? It helps your body to not overreact when it's exposed to a virus or a bacteria or some type of infectious agent. And exercise in and of itself is a stress on the body and can create more inflammatory proteins and cytokines. So lysine helps to attenuate that too. Now, would I recommend the arginine, and lysine on a daily basis for someone who's doing regular workouts and just kind of to prevent inflammatory processes? Maybe not, but those of you who are training for something and starting to really feel, when you're getting that high mileage towards that marathon, when you start to up and up and up your mileage, I might think of it that way, or someone who's training for certain triathlons or Ironmans, things of that nature, that's when you might want to be considering getting this on a regular basis. Or if you're just like after the event, you're like, I just need some post-event rehab, this is when I would do an injection of the ornithine, arginine, lysine. There's also IVs as well, just as a side note, but in my office I tend to do the injections for folks. Now, athletic recovery, as I mentioned before, branched chain amino acids, the isoleucine, leucine, and valine, those guys are great for preventing post-workout pain, but they're also useful in liver cirrhosis. So working to heal up the cirrhosis, kind of regenerate the liver, if you will. Kidney failure, also beneficial there. Wound healing, I've mentioned exercise fatigue, but also branched chain aminos can stimulate insulin production. So if someone's struggling to make insulin, maybe newly diagnosed type 2 diabetic, maybe someone who's noticing a little bit of insulin resistance, this could be beneficial. Glutamine and glycine are also two amazing amino acids to help prevent gut irritation with workouts. Now, I'd mentioned this before, and we'll still say it over and over again. These guys are a great combo and great for recovery post-workout. And then the glycine, of course, helps with sleep. So athletic recovery, daily recovery. I think all of us need to be thinking about what happens on a daily basis with stress and all of us and how it builds up. What can we do to prevent ourselves from having issues down the road? What can we do to help recover from every single day? Glutamine and glycine would be something to consider, especially if you're struggling with gut issues and insomnia. Now let's move on to digestive health, because if you've listened to this podcast, you know I really like to talk about the gut over and over and over again. But in particular, digestive health is huge when it comes to amino acids. And in particular, glutamine is my most favorite. If you've come into my practice, you know me, you know I'm going to be like, oh, you got gut issues, you need that glutamine. And you can take anywhere from 3 grams to 15 grams. Now, glutamine, when it's working in its full capacity, you're going to notice that your digestion will improve. Your stools are going to get a little firmer, especially if you have diarrhea. So if you're prone towards constipation, keep the dosing of the glutamine on the lower end. If you're having diarrhea, move that dosing of glutamine up to 15 grams. Glutamine is used in cancer patients who are struggling with gut issues. It's used in kidney failure. It's used in a lot of conditions that need regeneration. And if you're struggling with your gut, glutamine can be one of the most amazing amino acids to help heal things up. Now, arginine, as I mentioned before, it's a circulation enhancer. It boosts nitric oxide within the body. Because I love to talk about circulation, I think it's at the root of why we have issues in the first place. Arginine for the gut has such a beneficial effect on the intestinal barrier. And there's been tons of studies done on pigs in particular because their guts are much like human guts. And all of the beneficial stuff that we're seeing in terms of recommendations of amino acids is actually coming from pig studies, just a side note. And in particular, one thing I did want to know that while I was doing the research for this podcast, I found that arginine has been also found to help with reducing mycotoxins within the gut. This is huge because a lot of folks struggle to get mold and fungus, let's put it this way, for lack of a better term, mold and fungus side effect stuff out of the gut. Mold and fungus in general that may live in the gut, to get it out of the body, detox it out of the body. And finding that arginine helps in this case is huge. So I decided I better pass that along. And now, why also does arginine help? It also helps with modulating immune system and histamine responses on the gut lining. Because nitric oxide can also help in regulating this, because arginine is a precursor to nitric oxide. So thinking about gut lining permeability and how do you want to prevent that? What can you do to prevent that? Arginine, big helper here. Now, nitric oxide is a blood vessel relaxer, dilator, and helps with enhancing circulation. If you don't want to supplement with arginine because say you have issues with herpes breakouts, you could supplement with arugula, spinach, and also beets. These are 3 things, celery as well. These are 4 foods now that are incredible for boosting nitrates in the body that then convert to nitric oxide. I think that could be extremely helpful for the gut, but also if you're struggling with mold issues in the body and in the gut in particular, yeast, candida, arginine. So now those guys are one thing. The next thing is talking about glycine for the gut. As I mentioned before, glycine is great for protecting the gut against injuries, but how does it work? What is it doing? It's working on what we call the brush border. And so it's where your lining kind of comes up and down. You have little like fingers in your gut lining, and it's incredible for helping to keep the function going on that lining. So it's keeping it from having those cells from separating apart so that you have that permeability, so leaky gut. But it's also helping with tissue oxygenation. So more oxygen, more blood circulation with arginine getting to the gut. Now you're helping to keep all of the nutrients going and getting to the gut, but also keeping the soil and the foundation healthy. So these are huge things for that gut as a whole. Now, why do we want as much oxygen and blood flow to the gut lining? Well, we want to be able to get nutrients across, but we also want to be able to keep those beneficial bacteria on the gut lining as healthy as stinking possible, because that's kind of the issue that a lot of people have. That's why microbiomes get messed up. That's why your gut bugs are messed up, because you're not getting enough blood flow, so circulation and oxygen and nutrients to that gut lining. And then we're eating irritating foods that separate apart the gut lining. And then if we don't have enough oxygen or nutrients or blood flow to the gut lining, then those cells aren't strong enough to stay connected. So you can see it's like a double-edged sword there. So one of the things that I found in the studies with the pigs is that the amino acid glutamate can change the composition of and the diversity of the microbiome, and in particular helps with Faecalibacterium prasunti and Roseburia. These are two microbiome, let's say, inhabitors, so bacteria, gut bugs, that we can't supplement. But if we know that there's an amino acid that can help to keep them strong, shoot, why not do that? Why not put that in a formula? So this is huge information that I found in this study on pigs. And I'm going to reference the study in the end of my notes at drjkraussnd.com. But glutamate being a factor here is huge. Now you might be thinking, okay, monosodium glutamate. I remember this MSG stuff from the Asian food. It makes me sick and gives me a headache. Glutamate is a part of that. It's just not the sodium and the one molecule of sodium connected to it. It's all just the glutamate here. So in this case, glutamate may not have the same effect as MSG on you, is what I'm saying. So don't be afraid of it. At least try it out. Especially if you get your microbiome testing and you find that you're missing Roseburia and you're missing Faecalibacterium prasunti. Both of these guys are really great beneficial bacteria that can help your diversify, but also help with function of your gut lining and help with breakdown of food and fermentation and things of that nature. Essentially, what I'm trying to say is that these two are ones that I find commonly low in people, but we don't have anything to supplement them with. So why not target it by strengthening the gut lining and target it by using an amino acid that actually helps to support their growth? This is a thought. So we have that. Now, I talked a lot about glycine over and over again, and glycine and threonine are really good pairs of amino acids for the gut lining. And in particular, threonine is really great for immune function. Now, I will have people get GI mapping tests, which are done by a company called Diagnostic Solutions. It's kind of one of my favorite tests. I like it better than Thrive or Viome because it's actually looking at the core of your stool. And what I'll find is that a lot of people have low gut immunity. So they'll have low production of something called secretory IgA. Threonine can help you to enhance that gut barrier immunological system and its integrity. And so it can help you to boost the secretory IgA, which is great news for a lot of folks who have chronic gut issues, like IBS, issues of that nature, where they're not getting results with gut bug killing protocols. They're not getting results by enhancing their digestion with amino acids. They're not getting results with your traditional types of treatments. And there's this need to let's support the gut lining with the fuel it needs, meaning the amino acids, but also help it with a clean diet, things of that nature. So this could be something that I think for those of you who are really struggling to get your gut on point and you found that your gut immunity is low, so you know that your secretory IgA levels are low, this is something to consider. And it's not something that I have pushed a lot in the past in terms of using threonine in particular, but I'm debating on thinking this might be something that could be extremely beneficial. So you've heard it from me, something to consider trying. I don't have personal experience in it right at the moment, but the data is showing that it can help with boosting immunological function, which I think is great because right now my traditional treatment for this has been synthetic colostrum, basically. So immunoglobulins delivered via capsule or powder to the gut and serving very much like goat's milk or goat colostrum. So there's a company called Mount Capra that has goat colostrum that helps with boosting the immunity of the gut lining. I've found that some people don't do as well with that, so I switched to the synthetic version from Microbiome Labs called Mega IgG. But I'm wondering if threonine might work better. So if you've played at all in the department with amino acids therapy for the gut and you haven't used threonine and you have a weak digestive system, this might be something for you. Now, methionine and cysteine are also really good for the gut and immunity. And I found that also in doing my research here. Now, methionine makes sense because it's a transfer molecule. It's going to help you detox the gut. It's going to help move nutrients to where it needs to be because of those methyl donors. Remember earlier in this podcast, you might have heard me say something called CH3. So a carbon with 3 hydrogens, that's a methyl group. And so it helps donate and move things through the body. And cysteine on its own, I mean, that's really an amino acid that supports, it's supporting other amino acids, and in particular taurine. And they work well together as antioxidants. So cysteine and taurine together can be a great combo for boosting the immunity of your gut lining along with the methionine. Now, you might be thinking to yourself, oh my gosh, doc, I don't want to take all of these individual. Well, guess what? There are combos of all of these that you can get out there, and Thorne has one, and other companies. I'll put the list of them in my podcast notes at drjkrausnd.com, because I do think that aminos for the gut might be the way to go if you are struggling to figure out what to do to improve your digestive system. I think we got to go back to basics like I've mentioned before. We need to make sure we're getting our sunlight. We need to make sure, because sunlight helps us with production of serotonin and subsequently the melatonin for sleep, but melatonin antioxidant for gut lining. So what I'm saying here is, if we can use amino acids now to help you with circulation and gut lining repair, this might be a great combo to help bolster things for you. Now, amino acids for the skin. These ones I like because I work a lot with skin in my office, and in particular, I'm always trying to see what I can do for anti-aging, right? I want to prevent the look of fine lines and wrinkles and advanced aging. And arginine, histidine, methionine, lysine, those guys are all amazing for boosting your skin health. And proline, lysine, glycine, those are all ones that are great for skin integrity. And leaning back towards talking about the gut again, proline, lysine, glycine, also great on the gut. So it's kind of similar things that help your gut lining are going to help your skin. Keep in mind, arginine is all about circulation. It's all about nitric oxide and enhancing blood flow to the skin. Skin of the gut, skin of your skin, same thing. Great stuff. Histidine, antioxidant capacity, but also transfer capacity, helps you to detox. Methionine, love that guy too for just helping with detox, and it works just like histidine, hand in hand. They're transfer agents working along the skin lining. And then lysine is antiviral, but it also boosts the immunity of the skin as well, and it can help with the bolstering of the collagen and making it look a lot thicker, stronger. So it's supportive in its case. And then the biggest thing that I want to mention with amino acids for the skin here is that they work well with peptides. So you've got your protein fragments from your protein breakdown, which are your aminos, and now you have short chain proteins, the peptides. Those guys together, great combo for skincare. So serums that are applied onto the skin with microneedling, that's one way to get these in. Yes, internally by taking an amino acid supplement, it can help because you can work on your gut skin and your skin, because your gut skin is a reflection of what's going on out here. So if your gut's messed up, your skin's got some issues as well. Maybe you're not seeing it right now. It might actually show up as advanced aging. If your gut immunity is low, a lot of times I'll see that in advanced aging in the skin. So something to think about in terms of your gut skin and your skin. Those guys are connected intricately, and the same aminos that work for one work with the other. So keep that in mind, and keep in mind the benefits for peptides as well in that department. Now, one other thing to mention about amino acids that benefit the skin combined with peptides is if you have a tendon, ligament, sprain, strain that just is nagging you, and it's an old injury, or it's a chronic just pain one that has gone beyond 6 months or so and is still bugging you, the combination of the peptide BPC-157 and taking things like proline, arginine, histidine can be extremely helpful in that healing of that sprain, strain, even muscle pulls, things of that nature. So oftentimes I'll have folks supplement internally with amino acids and then take an injection of the BPC-157, which is the peptide that helps with regeneration of tendon, ligament, sprain, strains, also muscle injuries as well. So something to think about there if you're looking for help with another type of skin or connective tissue, if you will. So something to think about. All right. Last but probably not least, and for a lot of people, you've probably been waiting for me to talk about the amino acids for weight loss. And yes, I did leave it at the end so you listen to all the other stuff. Yeah, method to my madness here. So I use a lot of injections in my office for helping folks to stimulate weight loss. And there's kind of mixed reviews from folks, and it's because you can't just expect to take an injection and the weight's going to fall off. You got to do the diet work. You got to do the exercise, the movement, the lifestyle, the stress management. It's kind of a part of a whole system. You can't do it on your own. So that's my disclaimer here. But I use methionine, inositol, and choline injections quite a bit in my office as a base. I will pair them with B12, so of course for energy, but I'll also pair them with carnitine for fat burn, or I will do a combination with vitamin B1 and B5. And those guys are working on insulin sensitivity, but also adrenal glands and just fat and carb burn. So let me give you a little breakdown on these for which one would you choose if you're interested in a certain aspect of energy production, fat loss, things of that nature. Now, the base being the methionine, keep in mind, methionine is a methyl donor. It's a detoxifier. It is a transfer agent. It helps move things around. And in particular, methionine's really, really, really good for helping with fat metabolism because it really just helps move things out of the fat and kind of help clear out those fat storage cells a little bit better. And it also helps the liver in particular to maintain processing of fatty acids. So we combine methionine with inositol and choline to help with the fat process, so lipogenesis and cleaning out, basically fat cleaning out. But we also use it for glucose metabolism and suppression of appetite. Inositol is the combination of the mix, so methionine, inositol, choline. Inositol is the one that helps with the glucose receptors. So it's almost helping your body to get glucose into the cells and metabolize it better versus storing it as fat. And it also is extremely helpful in protecting us against insulin resistance. And it has a benefit and it's effective in reducing insulin resistance in this case. Now, you'd have to use it for a while. If I'm looking at a severe case of insulin resistance, or I'm looking at someone that's just been battling it for a long time and just found out that they had it, I would usually use an oral supplementation of inositol to help support the injections, if you will. Now, choline reduces fat deposition within the body, and it accelerates transport of the fats outside of the cells. And this is where choline and methionine work together to kind of pull the fat out of the cells and get things moving. The cool thing about choline is that it also reduces leptin. And leptin, if it's elevated in you, so or you have leptin resistance, you might have increased hunger, but you also might have the inability to tell yourself you are full. And that's what choline does. It helps you to feel full, longer. And if you add in carnitine to this injection, now you've got a little bit extra added kick in the pants to help you to burn that fat. So I really like to use those guys together. So methionine, inositol, choline with carnitine. I also love to put in a B vitamin 2, which is B12 typically. B12 boosts energy. It helps with immunity. It helps with calming of the nervous system. It's got a lot of great benefits. And typically I will use it within the injection and maybe just a little bit extra, because I think what comes in the standard injections for office use is just not enough to get the full effect. Now, the other B vitamins that I mentioned before that I like to use with my methionine, inositol, choline combinations have to do with vitamin B1 and B5. Now, vitamin B1 is known as thiamine. Thiamine helps when folks are struggling with tingling and numbness in the hands and feet and the loss of muscle reflexes. This is common in anyone who's diabetic or has extreme issues with insulin resistance. And so it's kind of headed towards diabetes, more or less. B1 can be incredible for that. Now, also B5, this is a vitamin that is great for helping to boost your adrenal function. So if you've really stressed yourself out to a point where you're struggling to keep your hormones in check, you're struggling to maintain your energy, things of that nature, B5 is incredible for this. It's also really great for helping with fat and carbohydrate burn as a whole. So when would I use one injection versus the other? if I was looking at someone who came in and has marked insulin resistance, I would use the MIC B12 with B1 and B5. So this is a combination formula. It also has carnitine and it's known as Lipo-C. And I would use that to help with the insulin resistance as well as the fat burn. Now, where would I put these injections? Oftentimes, I will put them into the muscle, but I'm a little rogue in other cases, and I go directly for the fatty deposits that someone has. And I use hips, go into the spare tire areas. Sometimes I will even go into areas on what I call the bat wings on the underneath part of the arms. Now, that's not traditional use of this. It's known as mesotherapy. It's a French-derived treatment where you are working to try to dissolve fat in fatty deposit areas. And why would I do this? I would do this because if you feel your fatty areas, they're often cold. There's not a lot of metabolism in that area. Your body's basically put it like a storage unit where you packed it full of crap that you were like, yeah, one day I'll go back and get that and use it, and you never go back, right? And you forget about it. I don't know how many people forget about storage units, and you see it on that TV show where people, buy the unit and then pillage what's in there. You need to consider that your body, if you have a lot of fat storage, that your body's likely forgotten about those areas and it needs a little reminder to kick it in the pants. And so that's why I do that. And I do those treatments in my office. So if you're in the Tacoma area or the Renton area, send me a message. Let's talk about it and see how I can help you. But Lipo-C is one that I like to use quite a bit in the fat dissolving department. And sometimes I will pair it with added carnitine to help the body as well. Now, one thing I will say, carnitine does have the possibility for some effects on the heart. So we have to make sure that we look at your labs first to make sure you're not one of those people that metabolizes homocysteine at a high level and will have an impact with the carnitine. So something to think about if you're concerned about doing injections and you have some heart issues. Look and see what your homocysteine levels are before you start using carnitine. That is a disclaimer. Now, in terms of just using straight MIC B12, I like to use the methionine, inositol, and B12 just on its own combo for folks who are maintaining their weight and trying to keep the weight in check. I'll do an injection once a week during a protocol for that. Or if we're actively, we've got through a lot of the main loss of fat for somebody and we're trying to keep things going and we've hit a plateau, I will use these injections as well for plateaus. But if you have some issues with insulin resistance and your blood sugar is elevated or you have type 2 diabetes, you want to be considering the Lipo-C more than just a straight MIC B12 injection. So those are my injections for weight loss and how we use them. And there are a lot of clinics around the world that use those particular combo formulas and in different capacities. But keep in mind that you can't just expect to get those injections and fat's going to fall off. It doesn't work that way. You have to do the exercise. You have to look at your diet and really be honest with yourself about what you're eating and what quantities. And that'll get you the most bang for your buck. So I went through a ton of amino acids today, and I hope that I've covered what you were looking for and the most common things out there that I use in my practice. Everything that I mentioned today are things that I do use in my practice day in, day out. Amino acid powders are a big deal, especially for my athletic recovery. And now that I've discovered more information that's more concrete for the gut, I think I'm going to start making them a part of my routine for the gut as well. So I'm going to put all of these details in my podcast notes at drjkrausenD.com because I know today was a hefty dose of college-like seminar information. So check out my podcast notes. That it's all going to be there. You won't miss a beat, and you can check out everything in that department. And I hope that you guys keep coming up with the questions. This is great information for me to know what you want to learn about and to deliver to you. So keep up the questions, keep up your requests for podcasts. I love it, and I will honor them and absolutely give you the information that you're looking for. So you guys have survived another episode of The Health Fix. I'm your host, Dr. Janine Krause. Have a great day, whatever you're doing.
Thank you for listening to another episode of the Health Fix Podcast. This podcast was brought to you by Blue Blocks, the blue light blocking glasses. If you followed me on Instagram, you will see me wearing my computer glasses. Those are the Galaxy version. They're fabulous. I have not been having headaches in my office thanks to those awful overhead lights that we have. Those buggers are blah. So anyway, blue light blocking glasses, game changers for your health. Check out them at blueblocks.com.